of acne and breakouts. So I'm super excited to launch our first ever live webinar where we'll be discussing some of the questions that have been put forward by our clients. Now, if you do have any questions throughout the course of this webinar, please feel free to pop them into the chat. And then once we finish the discussion, at the end, we'll address those questions. Okay, so I think it's really important that we kickstart it off with the definition of how acne occurs initially and what goes into that. So there are three key physiological components. The first one being an excess of oil or poor quality of oil production in our skin. So this generally happens sometimes when we're stressed. Stress can elevate our hormone levels to produce excess oil. That's why sometimes we can also see a spike of breakouts prior to our cycle. And we may also see an increase of oil when we are consuming a lot of dairy in our diet. The second contribution to what creates breakouts can actually be the incorrect pH of our skin. So our skin is naturally a little bit acidic. It sits at approximately 4.5 on the pH scale. So when we disrupt our pH or alter the pH, we actually create a situation where our skin's barrier is compromised. And when it's compromised, it means that it creates an environment for P. acne bacteria to thrive within the skin, and which can contribute to further breakouts. Lastly, the other factor is blockages of the hair follicle. So this can actually come from a hereditary factor as well. Some clients are more prone to what's called retention hyperkeratosis. Retention meaning retaining, keratosis, dead skin, hyper, too much. So we naturally have this situation where our skin retains all this dead skin on the surface. That then can mix with excess oil, residue of makeup, and just any sort of superficial debris that accumulates throughout the day, and can all lead to the perfect recipe or environment for us to experience breakouts. So how can we look after our skin at home? It is super, super, super important to hydrate our skin more now than ever when we're at home in environments with the heating on. By hydrating our skin, we're actually going to be working on rebalancing and doing for our epidermis what it can't do naturally for itself. We'll also be recorrecting our pH balance, ensuring we've got that strong barrier. The second thing that we need to do is also try to eliminate dairy from our diets. As mentioned before, when we consume a lot of dairy, there is a hormone in dairy that can trigger high doses of androgens, more specifically testosterone. And testosterone can lead to excess oil flow. As best as we can, we also need to try and reduce stress, which is easier said than done. And lastly, we need to avoid over-exfoliating our skin. So it's quite common for clients who are prone to breakout to actually exfoliate on a daily basis in the hopes that by cleaning their skin so excessively, they're going to help minimize their breakouts. But in actual fact, it will have the reverse side effect where we'll be stripping our natural barrier and compromising our pH. So how can we be taking care of our skin for the long run in order to maintain results? So as therapists, we are always 100% committed to our clients in order to get you the best results possible. So we then ask for that same level of commitment from our clients. It is a journey, and unfortunately, there's just no such thing as a quick fix. I usually use the analogy of going to the gym because I find that that's most relatable. So if you have a target or a goal whereby you want to lose weight, or even if you want to be a bodybuilder, it means that you have to have consistent commitment to going to the gym. And it means that you also have to eat the right foods in your diet. The same analogy can be applied to our skin. So we need to ensure that we are coming in for consistent and regular treatments in the clinic, and we need to ensure that we're feeding our skin the right ingredients. So there is essentially no exercise for our skin, but think of it as then when you're coming into the clinic, that's the exercise for your skin. In addition to home care, we need to look for specific key ingredients that have a very, very, very special role in how we treat the skin. So some of those can include zinc, magnesium, topical probiotics, healing colloidal minerals, and salicylic acid. Now, these special ingredients have a role at different times in your skin journey, and depending on the grade of acne that you have, will depend on when we introduce these ingredients. Okay, so essential fatty acids, or EFAs. Some of you may have heard about EFAs or read, material online about EFAs. What we know now is that there is a huge link between what we have on our skin and what happens internally in our gut health and in our systems. So essential fatty acids can basically help to improve our thick, gloopy, poor quality oil, which is the oil that's at risk of clogging our follicles, into liquid gold, into free-flowing oil that helps to make up part of our barrier and what protects our skin. EFAs can also help with gut health. It can help with improving digestive and liver function. So overall, this will help to minimize inflammation and toxicity in our bodies, which in turn can improve our skin health. Now, makeup. Makeup is something that's often overlooked, and I want our clients to think of makeup as an extension of our skincare. So it's really frustrating when we get great results in the clinic, clients are committed to regular visits and using the right home care, but then go home and use generic makeup, which has the risk of cancelling out all the progress that we make with your results. So basically, we always suggest the use of a mineral makeup. So mineral makeup won't clog the pores. It also has really beneficial ingredients for the skin, such as zinc and titanium dioxide, which are both anti-inflammatories. So our approach to treating acne, first and foremost, as we've discussed, we want to hydrate the skin. We want to rebalance what the skin is lacking. We want to work on reducing inflammation and redness, and that's skin sensitivity. Once those two have been achieved, then we're going to work on cleaning out the follicles, removing those blockages. And then if necessary, we can work on targeting any residual scarring that may be left. Now, we have a very long list of treatments on our menu at BC Dermal that can be used to within this approach. And what we would suggest is a consultation. So after a consultation, after a thorough consultation, we'll discuss with you your very specific concerns and create a treatment plan and product routine that is specific and personalised to you. We will be offering complimentary online consultations, which are normally valued at $75. And as an extra gift to you to get started on your journey, we've provided a discount code of acne10 for you to get an extra 10% off on our online store. So I'm now going to open up the chat screen to take any questions. Okay, so our first question is, why should I be avoiding exfoliating my skin? Wouldn't that help get rid of the dead skin? Which is a great question, because most clients do want to just get in there and clean the skin up on a daily basis, exfoliate, scrub off all of the acne that they think will help. But what they're doing essentially is they are stripping back that natural barrier. They're creating a vulnerability and sensitivity in the skin that actually in turn makes acne worse. So we do recommend exfoliating the skin, but we would introduce that step once the balance and hydration has been restored. Now, every situation may be different, and so it comes down to different results and different skin types. Okay, so moving on to the next question. Okay, I don't want to spend thousands on skincare. Which products can you recommend? So this is actually perfect because our model for approaching the skin is to always start off with core four. So we always start off with 4 basic skincare products to look after the skin, and they include a daily cleanser, a corrective serum, a SPF moisturizer, and a night cream. And that's usually a great start where you'll start to see a change in the skin. Once you've got that under control, we can then start to introduce more superior and more advanced products where necessary, such as exfoliants, eye creams, masks, and so forth. Okay, so next question. Can extractions help acne? Absolutely. Most people who are prone to breakouts normally find that they're always tempted to get in and pick. However, we need to do this in the correct way in order to minimize scarring and what potential risk of that to the skin. So we need to look at the grade of acne. Generally, grades 1 and 2 acne don't have a lot of inflammation. They are mostly whiteheads and blackheads, which in a facial treatment, such as a microdermabrasion or chemical peel, in clinic, we are more than happy to extract for you. However, when we're looking at grades of acne, such as 3 and 4, where there's a lot of inflammation in the skin, it's recommended that we first reduce that inflammation before we go in there and start picking away at pimples, which can in the long run make it a lot worse. Okay, so next question. How do we know if I'm producing good or bad oils? That's an interesting one actually, because people often think to have an oily skin is bad, but it's not the case at all. We actually need some good healthy oil flow on our skin to create part of what makes up our barrier, which is a layer of oil and a layer of water known as the acid mantle or the pH of our skin. So if we're producing these healthy, beautiful oils, generally you won't be experiencing any problematic concerns. Where we have bad oils, you can generally recognize that as thicker oil that actually creates a blockage and sits in your follicles. When we attempt to extract those oils in the clinic, they often come out as like a little oil plug and quite hard to the touch, quite waxy. Okay. Next question. Are face masks included in the umbrella of exfoliation, or can they be beneficial? Absolutely. So with face masks, I liken them to giving yourself a mini treatment at home when you're not able to get into the clinic to see us, or to do in between appointments to accelerate your results. So we would normally recommend that you use a light exfoliant to remove any buildup of dead skin, and then apply a mask to allow those ingredients to have the best absorption into the skin. Okay, someone wants to meet my dog, which you've probably heard her barking in the background. I've been trying to feed her treats under the table so she stops, but I'll definitely show her at the end of the discussion. Next question. I've been using skincare for oily skin for my acne, but now my skin is super dry, but I still have acne. What should I be doing? Perfect. So this is the exact scenario that we've been talking about, where clients generally gravitate towards ingredients or brands that are oil-free and just strip back the skin's barrier in an attempt to reduce that excess oil flow and quality of oil. But it's all about finding balance. So what I would suggest to this client is that you send us a message privately so we can get in contact with you over a consultation and go through what you can tweak in your existing routine to help with that dryness. Okay, I've been using skincare. We've done that one. Can steaming help acne? So steaming, we at VC Dermal don't steam the skin. steaming is it can be effective, but it's a very old method or modality of helping to improve the skin. But the basics of steaming is that it helps to soften the skin in order for us to do more effective extractions. But it doesn't help acne in any way with regards to oil flow or pH or balancing hydration. It's more about softening the skin in order to do those extractions. Do you have any brands of skincare products which you recommend? So we recommend Lyra. Now we have had Lyra for a few years now, and in that time we've also had other brands of skincare, and what we found is that we were just getting far more superior results with Lyra, and all of our staff just tended to gravitate towards it because it just had such a great feedback from our clients. So we most definitely recommend Lyra. We train with Lyra. As I said, all of our staff use Lyra. So we can provide you with first-hand experience because obviously we have to practice what we preach. Okay. The hype around niacinamide. So niacinamide can be found in different forms. Funnily enough, Lyra don't have niacinamide in a lot of their correctives. Where they use niacinamide is in their SPFs. Niacinamide is amazing for skin immunity and skin health. So we use niacinamide in our SPF, but we don't use it in our other actives because we've just found that there are so many other special ingredients that can have the same, if not better, benefits to niacinamide. I may contact you after this webinar to that client, so I can talk to you a little bit more about your concerns and how we can recommend some other skincare for you than niacinamide. Okay, next question. I get breakouts on my bottom and my back, which occasionally become really large and inflamed. What would you recommend for this? Okay, so with regards to breakouts on the body, we normally look at what factors could be triggering these to occur. So what I would suggest again is that we privately book some time for an online consultation so we can learn a little bit more about your lifestyle. For example, are these breakouts occurring after you've gone to the gym? Is it an allergy to your clothing, cotton? Could it be from your diet? There are so many things, intrinsic and extrinsic, that could be relating to these breakouts. So I would definitely like to learn a little bit more about this client and her situation in order to provide more accurate information. Okay, good one. Would you recommend treating acne with antibiotics? So that's a great question. I'm glad that someone's brought up medication. So as we've discussed, acne is a long-term, or the treatment of acne is a long-term commitment. And quite often clients, it's human nature to want results now, but it's not often the best approach to go too hard too fast. So the way medications work, whether it be the pill, antibiotics, or even Roaccutane, is that they are a short-term solution. So antibiotics and the pill, particularly the pill, will work on balancing hormones, and hormones can, once those hormones are balanced, can help with minimizing excess oil and the quality of oil. Antibiotics may also have the same effect in killing NEP bacteria in the skin and quality of oil control. However, when you come off that medication, what will happen is the skin will just go back to square one because the antibiotics or the medication hasn't addressed the cause and the triggers that may have created the skin condition in the first place. So our approach is always a long-term approach where we're looking at changing someone's lifestyle so that they can identify what's actually triggering their skin to contribute to these breakouts. Okay, so providing some tips for hydrating the skin. Absolutely. So with hydration, we look at your skin type and we can definitely recommend different ingredients or products to help with hydration. But some key ingredients that you want to look for include hyaluronic acid. Hyaluronic acid is a natural humectant, meaning that it binds more moisture into the skin. So it can help with improving hydration levels. How does skin needling treatments help acne? So skin needling treatments can be very effective at treating acne. Basically, skin needling is the use of tiny, tiny, tiny microscopic needles, which when glided over the skin, create tiny little punctures, pathways or channels. It creates an oxygen pathway in the skin. And P. acne bacteria can't survive in the skin when exposed to oxygen. So it's a process in which we can eliminate the bacteria in the skin. Skin needling can also help with stimulating collagen and elastin. So it can be really repairing for any clients who have scarring left over from breakouts, and it can also help with normalizing pigment production. So if you are a skin type that's naturally a little bit more olive or tanned in complexion, you may also have a higher risk of pigment post breakouts, and skin needling can also help with that. Now, skin needling is not for everybody. We would have a look at your skin type and the grade of acne. Generally speaking, we would only perform skin needling on acne grades 1 and 2, where there's no inflammation. We would avoid going down the path of skin needling on grade 3 and 4, only until we control the inflammation, reduce that, and then we can move forward. Okay, so next question. I have sensitive skin and often get rashes on my legs and sometimes my stomach whenever I'm in the shower. Could it be the temperature, or is it a flare-up related to blood circulation? Okay, that's a good question. So definitely showering in extremely hot water can contribute to stripping back our natural barrier. So that could be in part why you may be getting a little bit rashy post shower, but I think there might be more to it than that. So I would prefer to speak to this client privately in an online consultation, just to dive in deeper into what could be contributing to that. I'd be interested to know if these rashes only come up after the shower, or do they pop up, during other times in this person's life. Okay. Next question. I've heard retinol is good for acne, but I get allergic reactions from it. What would you recommend? So retinol is, I'm not going to say a tricky ingredient, but there's a little bit of a rule with retinol. Retinol needs to be introduced gradually. Our general approach is that we would use it every third day for a couple of weeks to allow the skin time to adjust to the absorption of the vitamin A. Once you've used it for a couple of weeks and you haven't had any sort of negative response, we then would say, okay, build up to twice every alternating night, for a couple of weeks. And then again, if you haven't had any negative response, you can build up to nightly use. So not everyone will be able to build up to nightly use. It really depends on your skin type. Some people can tolerate retinol very well. Others may have a little bit more of a sensitivity to it. And quite commonly, people who go too hard, too fast with retinol say that they are allergic, which isn't always necessarily the case. It just could be that you've used too much, too quickly, too soon. But I think if explaining how retinol works will also make more sense, and that is that retinol is the only ingredient that is scientifically proven to penetrate into or past our cell wall into our cell to communicate to the nucleus within our cells and repair damage to DNA. So it's a really active ingredient. And if we use too much of it too soon, our cell doesn't know what to do with it. And so it has what's known as a retinoic reaction or response, which is typically seen as redness, sensitivity, a little bit of itchiness, and perhaps breakouts. So once we recognize that, we can advise our clients, okay, it's not a bad thing. It just means we've gone too hard, too far. So let's cut back a little bit, start off every third night and see how you go and slowly build. But it's important to know that it's not common to have allergic reactions to retinol, but simply that we're using too much of it too quickly. Okay, next question. When dealing with hormonal acne, in your prescribed treatment plan, would you only target the lower half of the face or the entire face? So definitely all of our treatments, we cover the full face, because although you may not have a concern to the upper half of the face, we can still provide you with great benefits with, hydration, plumping the skin, refining pores, brightening the skin, reducing pigmentations. There's a long list of benefits that you can get from our treatment menu when we're treating the whole face, not only pertaining to acne. Okay, is it okay to use a face wash cloth when cleaning acne prone skin, or is it too rough? Okay, so this is a great question. Again, coming back to the different grades of acne. So if you are a grade 3 or 4 acne, that is characterized by lots and lots of inflammation in the skin, lots of redness and sensitivity. So in my opinion, using a face wash on the skin on a grade 3 or 4 acne would be too harsh. Face cloth, the harshness of the material would be considered a physical exfoliant. So that rubbing on the skin may actually aggravate the inflammation more. So what we would suggest is, if you are wanting to exfoliate a grade 3 or 4 acne, is to use an enzyme cleanser. So an enzyme cleanser has ingredients, predominantly fruit enzymes, that work on gently munching away any sort of surface debris. But an enzyme is gentle enough that it doesn't actually start to strip back the skin and provide any deeper exfoliation. It's only working on the very surface. So when you start using an enzyme cleanser, you'll see, notice a difference in your skin rather than reverting to the use of a face wash. Okay. Next question. A few of my friends have been taking supplements for their skin. Should I be using them? Absolutely. So I think the way we approach treatments now is a lot different to the way we approached it 10 years ago. There's so much more information available online and circulating on social media with regards to the link between our internal systems and what happens on our skin. So most definitely helping our internal systems with supplements can help improve our skin on the surface as well. So just to recap, EFAs are essential fatty acids, as well as zinc supplements can be very, very effective. I've recommended them to many of my clients and have been provided with great feedback. In terms of branding, at our clinic, we are now stocking JS Health vitamins. So they're a very well-renowned brand for supplements. And so they should be up on our website for you to have a look at. But again, with a consultation, we'll be able to provide more thorough information about that. Okay. Any other questions? No, okay. If there's anything that I haven't been clear enough on or specific enough on, please don't hesitate to get in contact. And as I mentioned before, we can most definitely organise online consultations for clients who want to go in a little bit more detail. Oh, you want to see my dog? Dolly, come here. Come here. Come here. I'll probably have to coax her with a treat. Come here. Here she is. She's not very happy to be on camera. I don't think she's a little bit shy. There we go. All right, so if there aren't any more questions, I guess we'll finish up today's webinar. I've really enjoyed speaking to everyone and answering your questions, and I hope that this is just the beginning of a series of webinars that we'll be able to produce for you. So I thank you for your time and joining us today.